Good morning. Welcome to the Toolbox talk on face fit testing. Face fit testing is very important to ensure that you get a proper seal for the face mask that you're wearing to make sure that you aren't exposing the wearer to any hazardous substances. So in this Toolbox talk, we'll be looking at the face fit testing method, the legal requirements, and any further guidance that goes with it. So we're talking about type fitting RPE today, and that's the type of RPE that requires a seal. So for example, your disposable half mask, your respirators, etc. There is an alternative RPE such as air-fed RPE, loose fitting, and that doesn't require face fit testing. But under the control of substances hazardous to health, the control of asbestos regs, confined space regs, and even ionising radiation regulations, the agency approved code of practices require that all RPE that's tight fitting should be face fit tested. And as I say, it relies on this seal to make sure that you're protected. Now, different faces and profiles change. Different people may have, for example, scars or different face profiles, which requires different types of masks. Not every mask will fit every individual and work correctly. And this face fit testing is all about making sure that what you are supplying to your worker is suitable and sufficient, and that you're not doing any harm. So face fit testing is a qualitative test. This is essentially a pass or a fail test, and what it involves is selecting the right RPE in the first place for the individual. Then they'll put a test hood on the individual themselves and introduce a sensitive substance to make sure that the seal maintains. Now, it's very important prior to doing this test that the individual doesn't eat or chew gum, etc., for at least 30 minutes before the test, as this can have a detrimental effect. And it's also important that there is no hair growth, stubble, etc., that may affect the seal. And essentially what they'll do is the tester, who will be a competent tester, will don the hood. They'll introduce a test sample initially so the individual can actually taste and see what the actual test sample tastes like. And then they'll make them wear their appropriate PPE that they'll be using for the tasks. So that may well include safety glasses, ear defenders, etc., anything that may affect the actual seal from the test itself. And then there's a set process for undertaking the tests. You'll do a sample test initially. You'll pump the agent into the hood and then go through a number of exercises, topping up the agent as you go. So the first exercise will be normal breathing, followed by deep breathing, then movements of the head from side to side, reading a passage or talking, bending or jogging in place, and then normal breathing again. So you're representing a number of the tasks that you would be doing whilst using the equipment to make sure that it's fit for purpose. If at any time that the user detects a smell or taste of the agent, then that will be a fail. So if that's the case, then you'd be wanting to look at alternative types of masks that would be suitable for the individual. So it's always best when you're undertaking face fit testing to have a few examples of the mask that you're going to be wearing. And it's important to note that you're face fit testing an individual mask to that operator. So if at any time that you change the mask, the supplier has upgraded the mask, for example, or you're using a cheap alternative, then you need to retest to make sure that that mask fits the individual as well. So it's important to do some groundwork before you do the testing to make sure that your supply chain is going to be fairly good, and that you can make sure that you can supply and use the masks. Now, face fit testing needs to be done before use. If there's any changes of the individual over a period of time, for example, they lose weight, they've had surgery, or again scars or injuries, etc., then you might want to redo the test sooner than the recommendation of every 2 years on a face fit test. Once the individual's tested, they're passed, and they carry on using the RPE, it's important that there's enforcement on the wearing of beards, stubble, long sideburns, or anything like that, or tight-fitting RPE, other PPE that then may affect the seal, because at the end of the day, the seal is there to protect the worker. If there is a reason that the individual will have to have a beard or unshaven through medical grounds, etc., then the employer would need to look at alternative solutions, such as loose fitting masks. So as an employer, you're responsible for ensuring that the RPE you provide to individuals is suitable and sufficient, that the face fit test is undertaken to prove that the RPE is okay, and to make sure that the people undertaking the tests are competent to do that. As an employee, it's important to remain clean shaven. It's important to make sure that if there is any facial changes, that you inform your employer, and also carry out your daily checks when you're installing the RPE to make sure that the seal is maintained. Finally, there is some further guidance on the subject. The agency produced a document called INDG 479, which is available to download on the agency website. There is also YouTube guidance on face fit testing. For example, 3M do a YouTube video training on how to undertake the test itself. For those undertaking the testing, there's a recommended course. It's called the Fit to Fit training, and it's a recognised format approved by the THSP. You can also get your consultancy, for example, THSP. We can come out and do face fit testing for you, or we can do train the trainer testing as well. So if you've got any further questions, please don't hesitate to contact us. Many thanks.